Hi, I'm Dr. Jyoti Patel. So today's topic is elimination diets. What is an elimination diet? It's a short-term meal plan that you work with your doctor to try to find out if there are trigger foods. Let's say you have irritable bowel syndrome and you have gas, bloating, and indigestion. There might be some foods that might be causing your symptoms. Okay? You might have joint pain or arthritis. You might have migraines or headaches. You might have an autoimmune condition, or you might have eczema or allergies or asthma. So this is a quick and easy way to try to see if there's a food that might be causing your symptoms or triggering some of your symptoms. Some patients will say, can I just do a food allergy test and see if I'm sensitive to foods? Of course, talk to your doctor, see if there are any blood tests you can do to check for IgE sensitivities like food allergies, or IgA, IgG food sensitivities, which are more food sensitivities and not allergy. The problem with these tests is that they're not always accurate, and you might get a false positive or false negative. So the gold standard is elimination diets. It's also free. So I'm going to walk you through my 3 steps for elimination diets for my patients. Okay? So first is record, second is eliminate, and 3 is reintroduce. Record, eliminate, reintroduce. Pretty simple. Okay. So record. I ask my patients for a week before their elimination diet to eat what they normally do and write everything down. I also want them to record their physical, mental, and emotional well-being, their sleep habits, their energy level, their bowels, and how they're functioning. I like to see everything. After they've done that for a week, we start the elimination phase. Now, that's removing a large portion of what they eat, and I know that bothers a lot of people. It's for 3 weeks. Okay, so my analogy is like if you went to the airport and you went through airport security. Everyone's on the other side of the barricade, and then one at a time, the passenger gets to go through the metal detector. If the metal detector goes off, they go back to get reevaluated, right? So we're doing the same thing with food, because food is a signal. Every time something enters your body, it either triggers your neurotransmitters in your neurological system, or it triggers your hormones in your endocrine system, or it alerts your immune system to cause inflammation and pain. So think of food as a signal, and it's either a signal that's right for you or a signal that's not right for you. And we're trying to figure out which one it is. So what are you going to eliminate? Okay, you're going to eliminate gluten, corn, soy. You're going to eliminate citrus, caffeine, alcohol. You're going to eliminate legumes like peanuts, seeds, and nuts. I know that seems like a lot, but again, doing that elimination gets us started to see which ones are going to cause or reactivate some of your symptoms. You eliminate these foods for 3 weeks. Then, when you're done, you still continue to record your symptoms during this elimination phase. Then you take one food group, like gluten. You reintroduce it for 3 days, 72 hours, breakfast, lunch, and dinner. And then record your symptoms. If you have a reactivation of your arthritis, if you have more indigestion, bloating, and gas, gluten goes back to the end of the line. And you start with something else. Let's say eggs. And 3 days later, you feel great. There's no reactivation of your symptoms. Eggs gets a pass. And you work through the list by adding things back in. Of course, it goes without saying that you need to eliminate refined sugar, processed and packaged food, no hydrogenated oils, and I also don't like restaurant food because you don't really know what you're getting there. Also look, if you are going to do a gluten elimination, you got to look at packages, you got to look at ingredients. Make sure you're not getting into your diet for those 3 weeks. What can you eat? You can eat vegetables, you can eat fruit, you can eat meat that you're not allergic to, and you can also eat some good fats like coconut oil and avocados and olives. I know it's restrictive, but it really does help to take one food group at a time, reintroduce it for 72 hours after a clean 3-week elimination. Why 3 weeks? Because it takes your body 3 weeks to decrease the antibodies it's producing against that particular food. So that gives you a nice clean slate. Doesn't mean you can't have that food group ever again. It just means that you have to do an elimination, get it out of your system for a while, and then reintroduce it to see if your body has gotten accustomed to it. Okay, so you have record your symptoms, you have elimination, and then you have reintroduction, one food group at a time, like you're going through airport security. Okay, so that's it for elimination diets. Thank you for joining me. I'm Dr. Jyoti Patel. Follow me on Facebook, Instagram, and Twitter. Till next time.